Welcome to the Empowered Flow podcast. I'm Tris Alexandra, holistic clinical nutritionist, women's health and menstrual cycle educator, and mama. Join me and experts in nutrition, fitness, mindset, and holistic healing as we explore conversations to open your mind to a different way of thinking on all things women's health, hormones, periods, cyclical living, and fertility. Whether you're seeking knowledge, inspiration, or a supportive community, you've found your tribe. Let's dive in. In this episode, I chat with Nat from Fertility Awareness Project all about FAM or fertility awareness methods and specifically charting irregular and PCOS cycles. Nat is a double certified fertility awareness educator, menstrual cycle coach, and social worker. As the founder of the Fertility Awareness Project and Fertility Knowledge Collective, Nat has empowered hundreds of people worldwide to chart their menstrual cycles for birth control through the online course Cycle Love. After discovering fertility awareness as a non-hormonal birth control option, Nat was inspired by the magic of body literacy and pursued formal training to help others gain control over their reproductive health. In the episode, we talk all about different FAM methods, what data you need to track and interpret irregular cycles. We talk about cervical mucus, basal body temperature. We talk about challenges when it comes to charting irregular cycles or PCOS cycles. And we also chat about Nat's personal journey with PCOS and having irregular cycles herself. Whether you're looking to explore FAM or dive deeper into body literacy, I hope you enjoy this episode and all the incredible knowledge that Nat has to share. Nat, welcome to the podcast. I'm so excited to chat to you all about irregular cycles, charting, PCOS, and all sorts of things today.
Yeah, I'm really excited to be here. Thanks for having me.
I really want to start with, given we both are, really passionate about sharing menstrual cycle education, I wanted to start with what day on your menstrual cycle are you on and how do you honor this phase of your cycle?
Oh, that's such a good question. I know exactly where I am relative to ovulation, but I need to check what actual cycle day I'm on. So I think it is, cycle day 37. So I just am in the middle of confirming ovulation. This has been a longer cycle for me. And in a longer cycle, I start to kind of lose all motivation for charting. So this cycle, I'm doing a experiment where I'm testing 3 different types of basal body temperature, 2 different types of LH tests. So the way that I'm caring for myself this cycle is by not giving up charting and just continuing to chart so that I don't miss my fertile window to do this experiment. So that's kind of like the long answer, but yeah, I'm definitely in the middle of confirming ovulation on cycle day 37.
Yeah, amazing. And I'm looking forward to diving into all about sort of charting for irregular cycles with you. But I want to hear from you a little bit about, tell us a little bit about yourself personally, professionally. What do you do?
Yeah, so where do I even start? I guess I found fertility awareness when I was looking for a non-hormonal method of birth control, and I knew that I didn't want to be on the pill, but I kind of felt like I had to be on something. So I was reading all these books and I was doing all this research and went to my nurse practitioner and was just feeling like I was kind of going to have to settle on like a barrier method or something like that. And my nurse practitioner was super supportive of me not going on birth control. And she had recommended that I look into natural family planning. And there was a workshop that I attended in person in a church basement on a Saturday morning. Me and my boyfriend got coffees at the coffee shop down the road and then walked to this basement office space and learned all about ovulation and cervical mucus and fertility awareness. And this was kind of the first time that I'd heard any of this. And from that point on, I was just pretty blown away, which is a very common experience I feel like a lot of people have when they learn FAM, that I could track ovulation. And that was 8 years ago. And I just dove into all of the different methods of fertility awareness, all of the Facebook groups, decided to train as a fertility awareness educator. And all while I was doing that, I was in school to be a social worker. I had started working in the field and was kind of my like dream was to eventually be able to teach people fertility awareness for birth control, and was kind of like building my business as a side hustle. And I was working a really stressful job in, as you can imagine, as a social worker in mental health.
Mm.
And when the pandemic happened, my cycles just became like so irregular. Like they
Mhm.
always have been, but it just got really bad when I was really stressed. So I left my job and went back to school and was trying to kind of figure out what I wanted to do. And then everybody was happy to be on Zoom and like wanted to learn in this way that I teach, which is mostly online. And so I never went back to my job, and I've been doing this full time since then. And I just love nerding out about methods of fertility awareness. I'm trained in 2 methods of fertility awareness now. I teach fertility awareness educators. And yeah, I just love all things ovulation and cervical mucus, and that's kind of where I got to where I am.
Love that. And I love, I know you share a lot on Instagram, and I think you're known as the cervical mucus queen on Instagram, which everybody loves except Instagram.
Exactly. That's so spot
Yeah.
on. Yeah. Totally. I know. I talk about cervical mucus a lot. I'm pretty like immune to the fact that some people might find it's gross, but I'm trained in a method of fertility awareness that's cervical mucus only. And I love helping people with cervical mucus so that it's less confusing and more simple. I feel like that's one of the things with fertility awareness where like there's so many conflicting things out there about how to
Mm.
track cervical mucus, and I feel like I've nailed down a really simple but effective way to do cervical mucus. But Instagram likes to remove photos and videos of cervical mucus that I post because they're flagged as sexual content. And if you just think about all of the shit that's on Instagram, the fact that like
Yeah.
very healthy, normal fluids that are produced by the cervix that change with our hormones are removed, it just kind of shows where we're at, I think, in society around women's bodies, and the
Yeah.
shame that still really exists around menstrual flow or menstrual blood, cervical mucus, all of those types of things.
Yeah, for sure. And I think it's a really, like, I love that you educate on this, because I think it's a really important topic for women to help to reconnect to their bodies and to understand their bodies from, even just to reconnect to their bodies, even outside of using it as fertility awareness. Um,
Totally.
can you talk to us about, like, when it comes to charting your cycles, when it comes to tracking your cycles, if someone has irregular cycles, I know that can be when people become really sort of confused, and it can become really difficult. And I know I've had clients with irregular cycles and PCOS before, where they feel like, oh, can I actually use fertility awareness methods because I have irregular cycles? How does that work? And it can become really sort of confusing, and they lose a lot of confidence with doing it. Do you want to, yeah, just talk to us about how we go about charting if we do have an irregular cycle?
Yeah, I can really relate to that. I've always had an irregular cycle from the time I started charting. And I can just speak from my own experience that like I think charting ovulation when you have irregular cycles allows you to have some sense of control and knowledge when everything else feels chaotic and unknown. With irregular cycles, basically, and longer cycles, specifically with PCOS, it's a classic symptom of PCOS, is that longer cycles mean ovulation is delayed. And thankfully, I think a lot of people now understand that it's really not so much that your period is late, but that ovulation is delayed. So when you're charting with fertility awareness, if you have longer cycles, knowing where you are relative to ovulation can give you so much peace of mind. So if I'm say right now I'm on day 37, and only now I'm able to say that I'm in my real kind of fertile window in terms of confirming ovulation. Whereas if I wasn't tracking my cycle, if I do confirm ovulation now, I'll probably get my period in about 14-ish days. So that would land me in kind of like the 50-day range. I would be like, where the heck is my period? It's day 51. What's going on? Whereas now I have this like real peace of mind and like knowing exactly where I am in my cycle. So I think it's such a valuable tool for people who have irregular cycles. But you're right, there is this like misconception that you need to have regular cycles to use fertility awareness. And I think part of that comes from the rhythm method thinking, where a lot of people still associate fertility awareness with the rhythm method, which basically guesses when you ovulate based on everyone ovulating on day 14 and having a 28-day cycle. Whereas the fertility awareness method is about tracking your real-time signs of ovulation. And no matter what cycle length you have, you can still, if you're ovulating, you can still track ovulation. The stickier part of it really comes into play when we go into like talking about fertility awareness for avoiding pregnancy. So I think from a health perspective, charting ovulation is really, really helpful. With fertility awareness, when you have delayed ovulation, this can mean in certain methods of fertility awareness, like say you're using a symptothermal method that uses a calculation to open the fertile window. This can mean a lot of abstaining from unprotected sex if ovulation is delayed. Now, certain methods are better at this than others, like the Billings method has a better protocol for delayed ovulation for like postpartum cycles, like the times when ovulation is delayed for months and months and months. But your typical kind of symptothermal method doesn't handle that super well. It doesn't mean you can't use fertility awareness. It just means that you might need to wait longer in terms of going unprotected. There might be a longer time in the cycle when you need to avoid that if you're avoiding pregnancy. But I would say like methods that have really good patch rules, like the Billings method, can handle that really a lot better than a method that uses a calculation. So I think that if you have irregular cycles, it's best to avoid DIYing fertility awareness. Because your ovulation signs are going to be there just like anyone else who has regular cycles. And you can confirm ovulation just like anyone else who has regular cycles. But managing the fertile window and opening the fertile window, if you want to go unprotected, I think working with an instructor is kind of the best way to navigate that because it isn't as DIY-able as like a regular cycle situation. But personally, I have found so much peace of mind in like advocating for my own like health stuff, knowing where I am in my cycle relative to ovulation. I think everybody with PCOS should be tracking their cycle. Like it is just such a valuable piece of information about our own bodies that if you're not charting it, you feel pretty in the dark, especially if your cycles aren't ticking along at every 28 days, which like how many people's cycles are. Like I would say most people don't have 28-day cycles.
Yeah, for sure. I would definitely agree with that. And I have a history of PCOS and long cycles as well. And I'd say from my experience too, when like I had PCOS for years before I ever started charting my cycles. And I very much felt like that. Like I had no idea when my next period was coming. I had no idea where in my cycle I was. It made me feel really sort of disconnected to my body and everything that was going on. And then when I started charting, you get that peace of mind and you just get that, especially when you can confirm ovulation, you know when your next period is coming. And it just gives you that window of like, oh, I actually know I've got a period coming. Like you feel a lot more confident in where things are at. And when it comes to tracking, like what data would you use or what method would you use? What data would you use to track irregular cycles?
Yeah, I think the one thing to know with tracking irregular cycles and long cycles, so say like you're not just having cycles that vary, so you're having more than just like a couple days of variation each cycle, but you're having like 40 or 50-day long cycles. If you're in that group of people, you're probably going to have multiple ovulation attempts. You're going to have hormonal changes in the cycle that don't necessarily end in ovulation. So if you've ever experienced like cervical mucus buildup and cervical mucus change, and even noticing peak type cervical mucus, but you can't confirm ovulation, that's very typical in a longer cycle. I think that's really important for people to know, especially if they're tracking cervical mucus, is that you can be fertile and not ovulate. You can have periods of fertility in your cycle that don't end in ovulation, and their potential fertility, right? Like we don't know when ovulation is going to happen, so we have to treat that as fertile. Um, and then once ovulation does happen, we can look back retrospectively and know if that was a time where ovulation occurred or not. So I think tracking cervical mucus, obviously, I think that's one of the most important fertility signs. And then also tracking a progesterone biomarker, because you can have the changes in estrogen that lead to fluctuations in the cervical mucus, but you want to have a biomarker like basal body temperature to confirm ovulation's taken place. With PCOS, LH testing can be really finicky. I have really struggled myself with LH testing, and as somebody with PCOS, it can be really hard to catch your LH positive. It can also mean that you have elevated LH levels to begin with, and so actually getting a positive can be really challenging. I would say that wouldn't be my number one fertility sign to track. I would stick with cervical mucus and basal body temperature. It always comes back to the method that you learn and how that method interprets the fertility signs and which fertility signs you need to track. So, for example, like a symptohormonal method like FEM, which is the first method that I learned, uses cervical mucus and LH testing. And I wouldn't say that would be a great method for somebody with PCOS. I would look into a symptothermal method, which relies on cervical mucus and basal body temperature, or a cervical mucus only method like Billings, um, to really have that kind of that sign, that cervical mucus sign to tell you when you might be potentially fertile, and then the basal body temperature rises once ovulation has taken place to confirm ovulation. And each method has its own kind of rules to interpret how many higher temperatures you need and how close that is to your peak day and what day you can go unprotected to know that ovulation's actually occurred. That is really covered under the methods themselves. Um, I teach a custom charting approach in my fertility awareness course, Cycle Love, primarily cervical mucus, basal body temperature, and then optional hormone testing. And hormone testing can be LH or prove progesterone tests. There is also estrogen testing out there. That's not something that I personally cover, but on a case-by-case basis, we'll bring in LH testing and sometimes the progesterone. But yeah, I think for someone with PCOS, a progesterone sign like basal body temperature is important, and then also something like cervical mucus to open the fertile window.
Yeah, amazing. And what if people struggle with like even noticing cervical mucus? Where do they start? Like say someone's like, I don't think I notice any, I don't have any, like yeah, where do they go from there?
Oh, this is my jam. I think I would first want to ask if they've been on birth control and have recently come off. So when you come off birth control, you'll find that your cervical mucus is pretty much the same day after day after day. And you probably don't notice a lot of the visible, famous cervical mucus. And the famous cervical mucus is stuff that's stretchy, clear, egg white, the stuff that you see in photos. You're probably not going to see a lot of that when you come off birth control. The crypts in your cervix that create cervical mucus are not yet producing that type of mucus because they've been turned off on hormonal birth control. So when you come off birth control, the changes in your cervical mucus are going to be very subtle. Similarly, if someone's had a LEEP procedure done on the cervix, this can also reduce the cervical mucus that's produced. The way that I teach mucus, and this is very influenced by the methods that I learned, and so every method is so different in how you chart mucus, but the way that I find works best, the way I teach my clients is a sensation-focused approach. So for somebody who doesn't feel like they have a lot of visible cervical mucus, you may have more subtle changes that you can tune into with sensation. So that's like thinking about the feeling that you feel when you get your period, that you know your period started. You don't even need to go to the bathroom. Like you feel like you're sitting in a puddle. That is sensation. So it's the feeling you feel out of the bathroom, off the toilet, right now, when you're listening to this podcast, you can tune into sensation. You might be feeling nothing. You might be feeling a drop of mucus, wet, moist, slippery, all of those types of things. That is going to really clue you into your cervical mucus pattern. Even if you're not seeing cervical mucus, you can tune into sensation, and that can be just as reliable as what you see. You might be looking for cervical mucus in looking for a really, really obvious, like that kind of, really egg whitey stuff in your underwear, which might happen around ovulation. But there might be kind of more subtle changes happening. It's really about tuning into your own pattern. And also sometimes looking at photos can be helpful as well to kind of see what you're looking for. I also hear a lot of people asking me about seeing cervical mucus every day. Like, is it okay to
Mm.
see cervical mucus every day? And what if you don't have any dry days? Because I think the typical thing you see is like you get your period and then you're dry, and then you see this egg white stuff, and then you're dry, and then you get your period. In reality, it's not like that. A lot of people don't have dry days. A lot of people with PCOS don't have dry days. So
Yeah.
that's like you feel and see something every day, and that is totally fine. It's about finding your own pattern, and your equivalent of dry or your lowest level of estrogen might be a little bit of something every day, and that's 100% okay. And you might have you might have something in between as you kind of gear up to ovulate, something a little lotiony, something a little moist, damp, creamy, like that type of stuff until you get around ovulation when you're seeing the most fertile cervical mucus. It's all potentially fertile, but the most fertile stuff you'll see around ovulation, and you'll be able to confirm ovulation once you do ovulate. But it's totally normal even after ovulation to not have dry days. And I don't ever have dry days. I don't see a lot of people who do have truly dry days, and that's totally normal.
Yeah, that's so good to know. But someone with the regular cycles, what are some considerations if they're using FAM methods for avoiding pregnancy? What are some considerations that they need to think about when it comes to, I guess, my thought is like confirming ovulation and making sure that their fertile window is closed.
Mhm. It's the same with regular cycles as it is with a PCOS cycle. So you will follow the same rules to confirm ovulation with temperature, for example. The exact same temperature shift rule will apply in an irregular cycle as it will in a regular cycle. I think the thing that can happen is you can maybe think that you've ovulated multiple times before it actually does happen, which is why having a progesterone sign like basal body temperature and applying a peak rule to your cervical mucus. So noticing that your cervical mucus is following this peak pattern, which is another indicator of ovulation, and having a cross-checking those two things together in a symptothermal method to be really sure that you have actually ovulated. I think in a regular cycle, it's easier to go, oh, this is the general time that I ovulate every cycle. I think I probably ovulated. Whereas with an irregular cycle, that can happen multiple times until you truly ovulate. And so it's easy to fall into a trap in regular cycles where you assume it happens at the same time every cycle. And you very well might have that happen for many, many, many cycles. Where in an irregular cycle is very unpredictable. And you want to follow the rules of a method, no matter what type of cycle you have. But in an irregular cycle, you would want to just, yeah, take ovulation on its own merit and make sure that it does meet the rules to confirm ovulation. This cycle, I'm on day 37. I was testing multiple types of LH tests, and one of the tests that I used said that I had a LH peak pattern and an LH surge like a few weeks ago. And I was having, what seemed like fertile cervical mucus, but I never confirmed ovulation with basal body temperature, with my peak day rule. And so you just kind of have to treat all of those ovulation attempts with some skepticism. But I think the same thing applies with regular cycles, because a cycle is regular until it isn't.
Yeah.
Life happens, and it's easy to fall into a trap of being like, well, I typically notice my temperature shift around day 16, and so now it's day 20. What's going on? What's wrong? Like all of these things. When that type of variation is normal, like we're human beings, we're not robots. And when we experience stress, even in regular cycles, this can delay ovulation. So I'm always telling my clients to really, take ovulation on its own merit. Never assume that you've ovulated just because in cycles previous you've ovulated at a certain time. Like, be skeptical until the data shows you that you actually have ovulated.
Yeah, there's some really good points. And I think we forget sometimes, particularly for people with a regular cycle, it can be really easy to forget that actually there's lots of factors that impact ovulation and impact our cycles. And so I often have clients, they'll be like, oh, I always have a 28-day cycle. I don't know what's happening. I'm like, well, let's look back on your life in the last 3 months. Like, it can be a number of months that could have affected ovulation this month. Like, what's happened? Like, where's your stress at? Where's your sleep at? What's come up in your life? There can be a number of things that that really impact us. And even I think even like if we have a cycle or two that looks different to our, quote unquote normal, or what we experience as normal, that's also normal. Like, it doesn't necessarily mean there's something wrong. It can just be that, all sorts of lifestyle factors and stress and things have had an impact. I know for me, like, stress is a really probably one of my biggest triggers and my biggest impacts on my menstrual cycle. And whenever I've had periods of stress, ovulation gets delayed, my period, my menstrual cycles become longer. So yeah, I totally resonate with that. And I know you've shared a little bit online about your journey with PCOS and having irregular cycles. Can you share with us what you've found, like both what you've noticed that can impact your cycles, what you've found that can help with having more regular cycles?
Yeah, I love that you brought up stress. And I think people with PCOS are way more sensitive to stress in terms of cycle regularity. In my life, every time I've experienced significant stress, I've had seasons of dealing with grief. I've had seasons of dealing with really stressful work situations. I think we can all relate to the stress during the pandemic. Like there's these
Yeah.
really big stresses that I think for people who are prone to having longer cycles, it just really exacerbates it. And it makes sense hormonally, it makes sense biologically that we would protect ourselves and our future children by not conceiving when we're under stress. Um, I've been on a personal journey of navigating anxiety and stress and overwhelm in my own life. And this has been so linked to my cycle. Um, from the time I started charting, my cycles have been very irregular. And like I said, it gets worse when I'm stressed out. I will go through times of things being more regular. I will typically ovulate on vacation. I don't know if you've noticed that for yourself. Like for some
Yes.
people,
Yeah.
travel is stressful, but for me, I'm like, I was just on a canoe trip this weekend and I very certain that that's why I actually ovulated this week because I was just like, my brain was clear, like my mind was clear. I was like in nature, like all of those things just do wonders for my own mental health. And then I end up ovulating.
Yeah.
So I have gone through so many different phases of like trying different things. And I know a lot of people with long cycles can relate to trying everything.
Mm.
And I have like tried all of the supplements. I have changed my diet. I have worked with a countless number of providers and practitioners and therapists. And I have not noticed a huge difference from all of those things. And I think I realized this in the last few years that um, if something that I'm doing is not helping my cycles, then it's just another source of stress. And I
Yeah.
think the
Yeah.
wellness, the wellness world and like existing online in the space that I exist, which is in fertility and hormone healing, I follow a lot of people who are in this space. I'm very aware of all of the different lifestyle and food and wellness things for PCOS. And I think it can be really helpful. There's a lot of things that I think have like positively benefited my health, regardless of my cycle length, right? But I
Mm.
think it
Yeah.
can also just be stressful. And I recently worked with a provider who did another like my however many like labs I've done, like a series of labs I've done. This was like my most recent one. And she recommended that I go on metformin. And I was pretty resistant to that. I would say I'm like hesitant about most medications. Um, and I was like, well, nothing else has helped. Like nothing else has really
Mm.
made a difference. So kind of just why not see? And if it helps, great. If not, I don't need to continue it. And that was in September of last year. And I've, other than right now, I'm in one longer cycle, but like up until now, I've had very regular cycles. I think it's made a big difference. And yeah, I think I just realized how stressful the wellness space can be, as
Yeah.
especially when we work in the wellness space. I think we
Yeah.
pick up on all of the shoulds, all of the expectations. We have guilt around not doing certain things or eating certain foods. And I think that can negatively impact our cycles. Um, and so, yeah, I'm not really taking many supplements right now. I go through different seasons and I'm really working on my stress and my mental health. And I think that has been like the most helpful thing. And I can say that confidently because I've tried everything. Like I have
Yeah.
tried
Yeah.
so many things. And I have realized that, yeah, those are like the main kind of drivers. And I know everybody is so different. Um, I'm still like mindful about like what I eat, and I'm mindful about all those different things, but it doesn't run my life. Like it's not a make or break thing. And I think that was the real difference for me. So it's a constant journey. In this summer, this summer I was having more new stress in my life, and my things have been really hectic and busy, and my cycle is showing that. And so it's very clear to me through my cycle when things are, yeah, out of balance, when I need to really start taking care of myself. I can see that with my cycle.
Yeah, and I think it's really important. I love that you've even with using metformin and trying metformin, you've come at it from a place of having the knowledge and then making that informed decision for yourself, and and trialing that out and deciding
Yeah.
for yourself how, is it working for you? Is it not working for you? And if it is, like, then that's great. Like if you've tried so many different things, it's like, for lots of people, it's worth experimenting and seeing what works and what doesn't, and then
Totally.
letting go of the things that don't work. If you've tried
Yeah.
something and, it's one of those things that you quote unquote should be doing, like we should be doing this with our nutrition, or we should be doing this with our lifestyle, and it's not
Yeah.
working for you, then let it go, because it adds so much more stress than what it's worth. And that stress, as we know, can really
Yeah.
exacerbate things. And I think the other thing that I really love is that because you're charting and because you're so in tune with your body and what's going on and where you're at in your cycle and being able to confirm ovulation, even with longer cycles, you just have this peace of mind of like, okay, I have a longer cycle. My ovulation has been delayed, but that's okay. Like that's actually
Totally.
okay. Yeah.
Yeah, and speaking to the informed consent piece, I actually had my doctor suggest I go on metformin. This was probably like a year and a half ago. And basically, she told me that if I wanted to get pregnant, come back and we can put you on metformin kind of thing, but
Mm.
had not really done any labs to really look into insulin resistance, or I hadn't done a glucose tolerance test, anything like that. It was kind of almost like the pill where it was like, we're going to offer you this because you have irregular cycles. We still don't really know why.
Mm.
And when I worked with this other provider who was more interested in like preventative medicine and root cause, kind of finding out why I wasn't ovulating, we did a glucose tolerance test together, and I did have insulin resistance. And so then I was able to make an informed choice of being like, well,
Yeah.
this is why my cycles are delayed. I know all of these things can play a part. I know stress can exacerbate insulin resistance. I know blood sugar balance, like all of those things, but also
Mm.
like I'm not just taking this medication because my doctor saw that I had irregular cycles and didn't really look into it. Do you know what I mean? Like
Yeah, for
it
sure.
was so
Yeah.
much more empowering to make a decision with all of the information, and it felt like a really great, like it felt positive. Whereas my doctor,
Yeah.
when I got that call, I was so discouraged because I was like, sure, great, that's an option, but I feel so dismissed that A, you're telling me my fertility doesn't matter unless I want kids.
Yeah.
And B, you're not even looking into it. It's just like it feels more like a band-aid. And I think that's so many people's experience in the doctor's office with being prescribed birth control too, where it's like, sorry, we don't really know what's wrong and we're not going to look into it. If you don't want to get pregnant, go on birth control. And that just feels so discouraging because you're not heard. Um, you're not really answering the question of like, well, why aren't you ovulating to begin with?
Yeah.
And that's what I really, that's what I think fertility awareness has given me, is this like well, I want to know why I'm not ovulating. Like, yes, I have irregular cycles, but like there's a reason for that.
Yeah, I think that's a really important point because that was my experience as well when I was first diagnosed with PCOS. I had, a couple of tests, an ultrasound to see cysts on my ovaries. Um, I had irregular cycles, and then I had, hair growth on my chin. I had acne, so they sort of confirmed that I had PCOS according to the Rotterdam criteria, which is absolutely fine. But then it was just a case of, okay, here, will you take the pill because you have irregular cycles? Come back when you want to fall pregnant because you won't be able to have, children naturally. You won't be able to fall pregnant naturally. And so it was just this whole dismissal of what was going on for me and my body, and just that kind of band-aid approach, that band-aid treatment. And then when I decided to come off the pill, it just, that was just a personal choice. It didn't sit well with me. It was, oh, we can just put you on metformin then. And I was like, by this stage, I'd done a little bit of research and I thought, well, I was the same. I haven't actually been tested if I have insulin resistance. Is this the right thing for me? And when I did push for those tests, there was no sign of insulin resistance. So for me, I was like, well, it doesn't make sense. That's not my driver of irregular cycles. There's something else going on. And, so that was my choice. But, yeah, I think it's really important to understand like what's going on for you in your body because every person with PCOS is different. And then we can come at it from a place of informed choice, informed consent that we can make these decisions for ourselves.
I love that. Yeah.
Mm. Anything else you want to share about your journey with PCOS or charting or anything that you find think that people will find helpful?
Yeah, I think I just hope that people feel empowered to advocate for themselves in the doctor's office. And I think part of that is through doing education, knowing where you are in your cycle, but also going into your provider with requests for different labs or research that you've done on your own. Because I think when you go in looking for answers, when you go to your primary care physician, I think you often run into dead ends, especially if you have PCOS. So it's okay to advocate for yourself. It's okay to not go on the pill if you don't want to. You are in charge of your own health journey. And I think, yeah, I think fertility awareness can be really helpful for that. And also, it can sometimes be stressful to chart ovulation if you're really hyper aware of everything that's going on in your cycle. So to really like ask yourself if charting and if the things that you're doing for your health are actually beneficial or if they're causing you more stress, and to really take stock of that and adjust as needed. And there's different seasons of life where I am charting through irregular cycles, and then other cycles like last cycle where I totally missed ovulation because I just stopped charting, and I'll just use protection. Like, it's not the end of the world. Um, but knowing that if you're using FAM to avoid pregnancy, it's going to be as effective as you make it. So if you are not charting, you're not relying on the efficacy of the method. You're relying on the efficacy of whatever barrier method or alternative sex you're having. And to just be mindful of that if you don't want to get pregnant.
Yeah, actually, we didn't touch on that, the effectiveness of FAM methods. Because I think
Yeah,
that's a really important one because I think a lot of people can be hesitant to use FAM methods because they're unsure of the effectiveness, say, in comparison to like the pill or to barrier methods.
totally. So yeah, fertility awareness in the fertile window is going to be as effective as whatever barrier method you use. So if you use a condom, if you use withdrawal, perfect withdrawal, diaphragm, all of those things have different efficacy levels or percentages. And if one of those things fails in the fertile window, then you are at a higher risk of getting pregnant. Um, Outside of the fertile window, there are multiple smaller studies that have been done on for different fertility awareness-based methods, but nothing super big and of great quality. So when you look at the studies of different methods, it's hard to equate some of those studies with, say, a large randomized controlled trial of a hormonal birth control pill, because fertility awareness just does not have that level of funding or research. As well, I think there is an element of, user awareness and user error in the efficacy of fertility awareness. So if somebody is taking known risks in the fertile window or is not charting every day when they should be charting every day, that's all going to impact efficacy. When someone is using fertility awareness and they're learning it with an instructor, they're not taking known risks, it can be as effective as some hormonal birth control methods. And it's really as effective as you make it. So working, like I said, working with an instructor, following the rules of a method, all of those things are going to, and using barrier methods properly in the fertile window are all going to increase efficacy. I've worked with 250, maybe close to 300 clients through Cycle Love. And I've also seen many people charting in the large Facebook groups, and we can kind of get a sense of informal efficacy through those routes. I don't see many method failures, if any method failures, from what I've seen for people using fertility awareness.
Yeah.
And when you're using the pill, if the pill fails, you don't necessarily know that that's happening. Whereas with FAM, you're fertile or infertile every single day, and you make decisions based on that information.
Amazing. This has been so helpful, Nat. Thank you. I'd love you to share, like, where can we find you online? How can people work with you, reach out to you if they're wanting to know more or work with you?
Yeah, we haven't really talked about the basics of FAM, and if people are wanting to learn more about how fertility awareness works for birth control and what you need to chart, I have a really in-depth video course called FAM Fundamentals, which you can find on my website, fertilityawarenessproject.ca/FAM-fundamentals. And I also have a newsletter that I send out every 2 weeks called The Fertile Flow. You can also find that on my website, fertilityawarenessproject.ca. I love writing, I love storytelling, and I love fertility awareness. So they all kind of come together in my newsletter. And then you can follow me on Instagram at Fertility Awareness Project.
Amazing. And I'll link all those in the show notes as well so people can find you. Thank you so much. It's you've just shared so much wonderful information, and I'm sure it's going to be really helpful for people listening.
I'm so glad. It's been a pleasure to chat with you and hear more about your story around PCOS. And I hope it's helpful for people navigating this on their own, that you're not alone. And yeah, it's just been a pleasure.
Thanks for joining us on the Empowered Flow podcast. If you enjoyed today's conversation, I'd love you to share it with a friend and take a moment to rate, review, and subscribe. Your support means the world and fuels our mission to empower women everywhere. You can also reach out to me on Instagram at Tris Alexandra Nutrition. Sending big love. I'll catch you in the next episode.